We're going to look at one article today that was just hot off the press this week. It was published in the Journal of Nutrition in the British Medical Journal. Okay, so we're not talking about some little small journal, right? British Medical Journal is like one of the biggest, largest medical journals, especially in the UK. It's actually referenced here in the United States as well. So anyways, this is a first study of its kind because we're getting more time, but there was, the main reason was to see if there's any interaction between diet and COVID infection severity. All right? Okay, so this is like hot off the press. All right, so the background, and this was first came to my attention from pcrm.org, but I went and looked at the abstract myself. So what happened? Okay, so several studies have hypothesized that dietary habits may be an important role in COVID-19 infection, severity symptoms, and duration of illnesses. However, no previous studies have been investigated and the association between the dietary patterns and COVID-19. Okay, so what they did is from 6 countries, France, Germany, Italy, Spain, United Kingdom or England, and the United States, with substantial COVID exposure, okay? So we're talking about people who were exposed to COVID-19 and a high risk. We're talking about healthcare workers taking care of sick patients, all right? As far as I can tell. And there's a web-based survey from July 17 to September 25 last year. Participants were provided information on demographic characteristics, dietary information, and COVID-19 outcomes. Okay, so what were the results? There were 568 COVID-19 cases and 2,316 controls. Among the 5,608 cases, 138 individuals had moderate to severe COVID-19, whereas 430 individuals had very mild to mild COVID severity. After adjusting for everything, guess what happens? All right, the results. After adjusting for confounders such as important confounders, participants who reported following a plant-based diet and a plant-based pescatarian diet. So these are vegetarians but eat fish, okay? All right, the plant-based diet solely had a 73% less likelihood of severe to moderate illness with COVID-19. How many percent? 73% less severe. Odds ratio, in other words, the exposure was there, they contracted the infection, but they had a 73% chance of getting a severe infection. The pesco-vegetarians had a 59% less severe odds ratio, okay? When compared with participants who reported following a plant-based diet, the others who followed a low-carbohydrate, high-protein diet had a greater odds of moderate to severe COVID-19 by 40, I can't find the number here. It was like 43%, 47%, something like that. So those who followed a high-fat, high-protein diet, most likely from animals, they had a higher odds ratio of contracting, not just contracting COVID, but having a worse infection with COVID-19. All right. So what does that tell us? We're starting to get some understanding as to how what we've been talking about from up here for a while actually is true. All right? So the bottom line is that by eating whole foods in a plant-based diet, which everybody's free to choose what they want to eat, but your odds ratio looks pretty good with COVID-19, not just COVID-19, but any infection. And they're talking about variants and the question about how long the vaccine lasts and all this kind of stuff. 73% protection just by eating healthfully. Amen? I think God knows what he's doing, right? He has the antidote. And it just comes with the Eden diet. And it's very simple, it's very nutritious, and you feel good. And so the conclusion from the study, and there's probably more to come, they said conclusion in 6 countries, plant-based diets or pescatarian diets were associated with an odds ratio that was better than what you'd get from a regular standard American diet. So my encouragement for you today is that we take a hard look at what we eat and try to give up things that may not be good for us. COVID is not going away anytime soon. So my advice is that we try to get back to God's original plan and just eat more healthfully. They'll save at the hospital. So anyway, but with that being said, God knows our bodies, He knows our physiology, and He knows what's best for us. And that's my prayer today. Amen.